2 quick checklists are not going to cut it. An evaluation that looks at both autism and ADHD, other known as AuDHD, are going to have to look at not just the overlap, but the differences between these two. So here's how that's structured. Hi, I'm Dr. James Thatcher, a licensed psychologist at Forest Psychological Clinic in Portland, Oregon. And I look at autism and ADHD at the same time because the overlap of these two issues can hide the other diagnoses or even mask both of them. And this video is for educational purposes only. And we're going to go through how I differentiate and what I use to look for in order to determine if someone has autism, ADHD, or both. So why assess for both of these issues at the same time? Well, like I was saying before, there is a lot of overlap between the two, to where there's social attention issues that are happening in both of them, executive functioning issues, and sensory issues. Sensory sensitivities can happen in both autism and ADHD. That's one of the criteria in autism, but about 90% of the time, sensory sensitivities are also happening in ADHD. So there's a lot of overlap between these two. Also, masking or compensation can obscure one or both of these issues. So we need to be looking at that aspect as well. And of course, the whole reason for an evaluation is to come up with an accurate plan. What's the way forward? What's going to help best? And knowing that you have both, or being sure that you only have one of these things, well, that's going to be a much more accurate plan forward. We want an accurate diagnosis. So what stays the same? What stays the same when you're evaluating for autism or ADHD? Well, it's a multi-method and multi-informant process. So whether you're looking for autism or ADHD, you're going to use various tests like a cognitive test, a D-KEFS, executive functioning tests, and all of those I would definitely use for an ADHD evaluation. And on top of that, you're going to get other informants. So you're going to be asking the teacher if they're a kid. You're going to be asking their parent, kid or adult. You're going to be asking if they're an adult, their partner. What are some of the different symptoms that you're seeing in regards to autism and ADHD that keep popping up, not just at home, but also at school? And the other thing that's going to overlap between these two evaluation processes is you're going to get into developmental history. Both of them, autism and ADHD, are neurological. They would have been going on since the person was a kid. So you've got to get that history in order to come to an accurate diagnosis. So when I'm just looking at autism, just to kind of give you an idea of like what I look for one versus another, some of the tools that I'll use is the ADOS when I'm looking at autism. To where that's the Autism Diagnostic Observation Scale. And that's a gold standard test that looks for symptoms of autism. Another thing that I'm going to be getting that day is conversational abilities, so social reciprocal abilities. What's their ability to hold a back and forth conversation? And I'm getting that from history. I'm getting that from observation. I'm getting that from the ADOS. So I'm getting all different types of data points that day that look at that. Another thing that I like to use for both, actually, but also for autism, there's certain scales on the ABAS, that's an adaptive behavior measure. There's certain scales on there that can help me determine, what's their social functioning. How impairing is this for them? Another aspect of autism testing is to get sensory and sensory regulation history. So if they're getting overwhelmed by certain sensory sensitivities, how are they regulating that? What are they doing when they're getting overwhelmed? How are they coping with that? And looking at ADHD, I'm going to be looking at a lot of executive functioning abilities. So I'm going to use tests like a cognitive test, like the WISC or the WAIS. The WISC is for children, the WAIS is for adults, or even the Stanford-Binet. to where there's lots of different executive functioning tests on there that look at processing speed and working memory and blocking and task switching. Another thing that I might use that day is something called the D-KEFS that looks at executive functioning as well. So being able to switch between various tasks, being able to use visual motor abilities, being able to block out extraneous information, being able to bring up information very quickly in your mind, different executive functioning tasks like that. Now, let me talk a little bit about how both autism and ADHD can overlap with one another and how they diverge from one another. So, one area where they overlap can be distractibility. So, in ADHD, it's difficulty paying attention, focusing. The same thing can happen in autism to where they might get so enveloped in an internal world or a fixation that they just lose all track of time. And so it can look very similar. Task initiation issues. So with ADHD, it's going to be hard to start a non-preferred task. That's going to be difficult. Same thing for autism. If there's not a clear reason behind it, like why would I want to do this extraneous, boring thing that doesn't align with the thing that's going on in my schedule, just to give you an example, they're not going to initiate it. They're not going to do it. And another area overlap is social misses, to where with ADHD, it might be that they're talking and they're excited and they're just paying attention to what they're talking about. And they might miss some of the social cues that other people are like, hey, I'm getting kind of bored with this. Same thing can happen in autism as well. But some of the differences start to pop up in social reciprocity, to where with folks with autism, that part can be harder. But with ADHD, there is reciprocity. They tend to be able to hold a conversation, be able to ask questions, be interested. And so can autistic people as well. I'm just giving you an example of a difference that I've seen in folks. Another one is restricted interests. So in this one, gets a little hairy at times, to where with ADHD, yes, they can hyperfocus, especially on preferred activities. But with restricted interests that are associated with autism, that's going to be a topic or a subject that they just keep going back to, that they've learned a lot about, that they've done a ton of research on. You try to talk about something else, but nope, they're going to just bring it back to what they're interested in. And they keep talking about it, no matter how many times you try to move on from it. And this is what they spend a lot of their time doing. So there is going to be a difference in regards to the level of intensity and duration of these issues. So why look at both? Why look at the overlap? Why look at the differences? Why look for AuDHD? Because accommodations are going to be different. The direction forward on treatment, on medications, on different resources, on self-understanding are all going to be different when you know both are present, or if it's just one. If you just have ADHD or if you just have autism, the supports and the accommodations are going to be different for all three of those different scenarios. So let me give you a couple of examples on what those recommendations and supports can look like. For kids who are in the classroom, what it can look like for kids with ADHD is longer time on tests. It could also look like sitting closer to the teacher. It can also look like going to a distraction-free room. That can also be the case with kids with autism and ADHD, or kids even with just autism, that they need a distraction-free room in order to participate. With autism, the accommodations could be having a social skills group at school. Same thing can happen with ADHD as well. Another aspect to look at is medications. There's no pill for autism, but there are pills that help, and there are medications. I shouldn't just call them straight up pills. There are medications for ADHD. And there's a lot of research out there that talks about how there's certain psychotropic medications that are more effective for folks that are on the autism spectrum versus not. So knowing that you're on the spectrum and getting treatment for ADHD And sharing that information with your medication provider is going to be essential. And one thing that I always encourage parents to do, and not just parents, but adults as well, is when you're seeking a medication provider, don't necessarily go for your PCP. They're wonderful in being able to mend bones, deal with stomach aches, deal with the flu, diagnose if you got a virus or not, but you want something more specialized. Go with a psychiatric nurse practitioner or a psychiatrist because this is their specialty and being able to work with psychotropic medications and how they interact with one another. And a good litmus test to ask them and to bring up is like, hey, what sort of medications for ADHD are there out there for me to take because I'm on the spectrum? What medications are there? And they should know that research. They should have an answer for you. If they don't have an answer for you, I would encourage you to move on and find somebody else because that research has been out there for years. I'm not going to share that here because I'm not a medication prescriber, but I am telling you that information is out there and they should know about it. So let me give you some questions that you can ask your clinic when you're deciding where do I go for an evaluation. Ask if they test for both autism and ADHD. Another question to ask is what tools do you use for each? And your clinician should go over these different tools. And some of the tools look at very similar things. And some of the tools look at different things. Like the ADOS, that's just looking at autism. But a cognitive test and the D-KEFS, that doesn't necessarily look at autism. There's certain subtests on the cognitive test that can give me an idea about autism, but for the most part, I am looking at executive functioning. And same thing with the D-KEFS. The D-KEFS is straight up executive functioning. Another good question is turnaround time. And when's the feedback? When am I going to get the results of this? When am I going to get the full report? Do I get it in the mail? Do I get it over email? You need to know, like, how fast are they? And another good question to ask is, do you coordinate with the school? Do you coordinate with college? Do you coordinate with disability services? And the answer should be yes. All you really have to do is fill out what's called an ROI or release of information. And the clinician should be able to work with that person. If you're considering a combined evaluation, you're going to want to get all your ducks in a row. You're going to want to get all the right documents and the right informants. And in the next video, I'm going to show you what documents to prep ahead of time, who to talk to, and how to get ready for your evaluation. I'll see you there. Bye.